Well, hello. So today, I thought I would give you some signs about addiction. ADDICTION, addiction. And that's a sign, addiction. It's kind of, um, usually I don't want to ruin my lipstick, but it's really if your finger is in your cheek, your mouth, not your cheek really, I guess, but it's in between your lips. And it means more like like you've been hooked, right? Like a fish has been hooked, so you're hooked or you're addicted. So I usually just do it right here because of lipstick. Anyway, I'm usually wearing lipstick when I work, and so it's a and you turn your head to the side and it kind of goes down, so it kind of sinks in. um and it shows you've been hooked like a fish. So if you have that in your mind, then you can remember the sign a little bit better. So, so this little article about addiction. So, and this is addiction. So an addict is a person who's addicted. So you would do addiction and then person, or so an addict is addiction person. I was going to do it backwards, but anyway. So, so many people think, well, oh, maybe if they've accidentally done something that would become an addiction, that they are now an addict, but they're not. And so there's some things that people don't think that they are addicted to, but yes, they really are. So we're going to give you some signs about that, and then also what the article says. Um, so it says that addiction itself is a persistent, so a continual dependence. Dependence. I use my dominant hand and push down on the non-dominant hand and using my index finger only, and it pushes it down. So the dependence, that you depend upon it. This is the strong one, and this is the one that's always kind of leaning on it. And so you always do the action with your dominant hand. If you did it non-dominant, the consistency and also the strength of the hand that you write with, and that's why you use that way. But it's consistency, because if you keep changing hands to be your dominant hand, then it looks odd, or you can see people's head um, kind of move, and so that's why I usually say your dominant hand does the action, because it keeps that consistency. So, so a dependency on any harmful behavior. So your B hand shapes, this is like action, except it goes this way. So behavior, because your behavior is this way and it swings this way and this way and this way, right? It's not necessarily means mood swings, but it's your behavior. Your behavior. So it can be a behavior, or it's a substance. And remember, we did substance is a thing. So we're holding whatever this is. And so this is why it's a kind of it's a sign, but it's also in a sense a classifier, because it represents something, whatever that substance is, and we'll discuss that. So substance. So so addiction itself is the dependence on a behavior or a substance. So and also it what does it do? It limits your use of your own choices. So if its dependence is so bad that you can't decide if you're going to do that or not do that, so you don't have choices. You're limited on your choices. Like I have to have, or I have to do, and we'll talk about that. So, so they can include these addictions or abuse of. Um, So tobacco, this is like, between your cheek when you dip snuff, or you just dip. And so this is a tobacco, any tobacco, because some people don't smoke. So you're holding a cigarette and you are smoking. So this is, and people say, well, do you have any tobacco use? So when I do that, I'll say smoke or tobacco, because they could and if they're saying what is that, I'll pull out my cheek and pretend like I'm putting in some dip or something like that, or to chew. So it's tobacco. Okay. And then the next one, okay, alcohol. So alcohol is like you rock. So it's your index and your pinky finger and on your dominant hand, and it's on the non-dominant hand, alcohol. This is alcohol in general. Sometimes with deaf people, you have to specify, but alcohol. And, I'm not sure why it's this sign, but sometimes I think it's like the handle of like a mug of something, but you don't use that to drink, right? But that's how I remember that this is alcohol. You can say, do you drink? And I use like a little shot glass. Do you drink? This is to drink a lot or binge drinking, drunk, and your head goes to the side because you're just drunk. Uh, and you don't have full control of your body movement. So any of that's drinking. Now, when I talked with a deaf person, and his doctor told him to stop drinking, right? Alcohol drinking. Now, I knew what that meant, but because he was addicted, I had to go because he said later, he goes, "Well, can I still drink wine?" Wine. No. So, not a spritz or anything. So sometimes I will go through the list with a deaf person if the doctor is saying no more drinking because your liver is damaged, then I would say no more beer, no more wine, no more, any kind of shots, alcohol, none, none. Nothing with alcohol, nothing. Like a hard lemonade or whatever they call them, or a spritzer or something, or a wine cooler, anything that has alcohol in it. So you can be specific. Okay, and then illicit drugs, and so that usually means like illegal drugs. So it's like showed you the sign like people use this for Coke, like Coca-Cola. Now that's the old sign for Coke. But now what they use if that person is addicted to cocaine is it's an open hand shape and on each nostril. Or you could even say, a line. I'm not really sure how they do that, but usually cocaine. Most deaf people, I have not seen deaf people who don't know that this is cocaine. So if you want to use like heroin, then that is also open hand shape, but you're going to close it. Is they're going to give themselves a shot in the arm. So that is that is like heroin. So they don't use this for cocaine anymore. That is used for Coca-Cola. It's an old sign. This is cocaine, heroin, and I'll say drugs with a D hand shape and in my circle in my hand, drugs. Because it can mean, but usually if you're talking about, and then marijuana, you have an F hand shape, and I know it's legal in some states and it's illegal in some states, and so, but regardless, if they want to know if they are like, if you go to a pain clinic, they want to know if you are using marijuana or CB gummies. You can spell that out or whatever. Because I don't know if there is a sign for that. They're not. It's not standardized. I'll put it that way. You can ask them. Okay. Or prescription drugs. So you can say, are you using a lot of pain medicine? This is the sign for medicine because they would grind it down. So this is medicine. Um, drugs, medicine. Sometimes I'll do prescription medicine. Sometimes I don't know what RX means. That is prescription. So sometimes I'll say, oh, pain medicine you take a lot of, or your psych meds like Xanax. It's an X. That's the sign for Xanax. And I'm not sure about some other ones, but I'll spell them out. And sometimes they are using a lot of, like how many milligrams do you use, or oh, those pills, how many do you take every day? So that's how you would ask that question. That's for prescription drugs. And behaviors include like watching porn, and I would spell out PORN. If you wanted to do naked people, but or having sex, so you'd have to go into really a lot of detail about that. Because it could be, gay lesbian sex, or it could be heterosexual sex, or it could just be watching. I don't know. So I would just do porn, on your, you know, do you watch porn? I would spell porn, and I've never had a deaf person not know porn. So, but if you have to, you might want to have to be specific about each of those things, what porn is. Um, Food disorders. So, disorder means like in chaos, things are not in order. But in this case, when you have like a syndrome or a disorder, it's more of like a problem. So, um, you would say a food problem. Do you eat too much, or do you eat and then go to the bathroom and throw up? Which? So those are food disorders or food illnesses. But see, if you say, oh, I get sick with this particular food or something like that. So you want to make sure it's clear. So if it is like an addiction, it's like food problem. I have a problem with food. I don't eat enough or I eat too much, right? And then compulsive spending. Spend, spend, spend. I have to spend, 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 spend. And then money's gone, right? Or gambling. Now, the sign for gambling is if you got the dice in your hands and you throw it. And I know it's die if it's multiple, but so if you have the dice in your hand and you throw it, you could also be addicted to the one-armed bandit or cards or the roulette, or the different tables. But gambling in general is throwing the dice. So they may say, "Oh, I don't do that," but that's if they're in an addiction program. So anyway, you might have to be specific if you are talking with someone in a recovery program. Um, let's see. Oh, and even at auctions, that's kind of, if you're auction, this is auction where I'm going to bid, I bid, I bid, I bid. Sometimes you're going, oh, I just want it. I want to bid higher than them. And then, I don't have enough money to pay for that. So auctions are sometimes addictive as well. Okay. Um, so it says that these behaviors um, and the things that they do are not necessarily addictive or they're an addict, but it can become an addiction. And so it's if you depend upon it, every day you must do whatever it is. Okay, so if you're an addict, I'm a recovery program. Oh, I relapsed. I fell down like you're like this is a slide, like your arm is a slide and you're this person and here's their legs and they've fallen down. This the slide is they, you know, I had had a backslide. Um, those kinds of things, that I was doing really good and then something happened and had a relapse. They slid down, right? They slid down this and they drank until they were drunk or, they took a lot of pills or did heroin or cocaine or whatever. So, so anyway, so those are the most of the behaviors and the substances that people are addicted to. Um, so if you want to discuss with your friends, with your family, anyone who's like hard of hearing or deaf, to do that and how you would make a sentence from that, or how you doing? Did you relapse? Are you in that recovery program again? Oh, good. I'm so glad that you started that. So practice, and I will see you later. Bye.